Good afternoon, or I should say still, it just turned afternoon. It's 12 o'clock here in Florida. We're at the Deuk Spine Institute. We are streaming live spine surgery for your viewing pleasure. Our patient is actually a Floridian. She comes here with back pain. She's had back pain, severe back pain for 2 years, on and off for many years. But it's gotten unbearable in the last 2 years. Like many people, she's tried to find a way to get rid of the back pain, but doctors only offer temporary treatments. So she came to Deuk Spine Institute. We diagnosed the source of the back pain, which is several things, but one of them is going to be her facet joints. Facet joints are a common cause of back pain. Go ahead. We're going to be treating her facet joint pain first. Then we'll go to the SI joints, which are causing pain, and finally the piriformis muscles. Facet joint pain is probably the second most common cause of chronic back pain, following the disc. In her case, she's got 4 facet joints on each side that are causing back pain. We're going to start with the top, which is L2. Let's show the audience how facet joints cause back pain.
For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
Sean, you can see from our video that facet joints are a common cause of back pain. In this patient, they are the main cause of her back pain. And we're targeting the exact spot where the medial branch of the dorsal ramus comes out and innervates the facet joint. Sean? If you look at the x-ray there, Jordan, show the audience where the transverse process is. The tip of my probe is sitting right on top of the transverse process, right where that pain nerve lives. So by going here and destroying the pain nerve, called the medial branch of the dorsal ramus, I will eliminate her facet pain once and for all, which is a good thing. All right. 2 down, 2 more to go on this side. Shot. Any questions from our audience?
No questions.
Well, we can't see the nerves in surgery. We're not exposing the entire spine. What we do is we can see the bones in the spine using an x-ray machine. That's what you guys are seeing right now. You're seeing that x-ray machine, and you're seeing what I see, which is the actual bony spine. The bony spine is not the problem. The problem is the pain nerve is overactive, and I have to go in and destroy that overactive pain nerve. Have we shown the audience how the Deuk plasma rhizotomy is done to get rid of facetogenic lower back pain?
Yes, we have.
So we did the source of facetogenic pain, and we did another animation on how the Deuk plasma rhizotomy works. I don't remember doing the second video, did we?
No, we did not do a second video on how we cure it. We can play that now if you'd like.
I think that's a great idea, Anthony. Let's do that.
Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. Let's put another incision here. We're going to make a second incision. I need to take an x-ray, sorry. Shot. All right, go ahead. Let's go. All right, that's better. Shot. So you can see from our video that there are little nerves that need to be targeted and treated. Shot. And those nerves are pain nerves called medial branch or dorsal ramus, and their exact location can be determined on an x-ray machine, which is what we're doing right now. We're using the x-ray machine to target them. I can feel the pain nerves being cut when I do the surgery. All right. Now, my next target is down there at the bottom of L5 S1 facet. Shot. A little bit too low. Shot. You have to be in exactly the right spot or the procedure doesn't work. Shot. It's getting better. This particular pain nerve right here is pretty deep down. Shot. Any questions from the audience?
No questions.
Shot. 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 All right. I think we're good with the facet joints on the patient's left side, L2 to S1. And now I'm going to go to the right side and do the same thing. Stapler. We're going to close these tiny 4mm incisions. We're going to move on to the opposite side. She has facet joint pain on both sides of her lower back. She has back pain on both sides. So we're going to treat the right side next. Shot. Show us once again the transverse processes. Yep. Go ahead. You guys can see the transverse process. It's a piece of bone that projects out laterally from the spine. Shot. Shot. All right. You've shown the audience both videos now.
Yes, I have.
So how facet joints get injured and cause pain, and then also how we can fix that pain with our plasma rhizotomy. Shot?
Yes, that's correct.
All right, so the tip of my probe is way out lateral on that transverse process. You guys see that? Jordan will show it to you. I had to move it more medially. Shot. A lot of arthritis. Arthritis is bony hypertrophy. The bone is getting enlarged. In this case, it's the facet joint that's getting enlarged. Shot. As the facet enlarges, it makes it more difficult to target the exact spot. because it pushes probes away. It pushes things away that are targeting that area. But I think we got it. Shot. That's perfect. Right there. That's that one. I'm going to try for the one above. Shot. Shot. I'm on the transverse process. I need to go more medial. Shot. I'm more medial now, which is where I want to be. Alright, that's good. And then I'm going to go inferior towards the next transverse process that has the pain nerve running across it. Alright. Our next procedure will be the SI joints. Very common cause of back pain is the SI joints, arthritis. Shot. Shot. I'm on the transverse process. You can see on the x-ray. Her spine's a little bit rotated. She has some scoliosis. It's not causing any symptoms, but it makes it harder for me to get to where I need to be. We're going to get there, don't worry. Shot. All right. And finally, we're going to go down and get the last one down there. Let's see if I can reach it. The other side made it more difficult. Any questions, Sean?
Yes, we have one question from John on YouTube.
Hi, John. Welcome. Sean?
What do you do to prevent the herniation from returning?
Knife. We're not treating a herniation in this patient, but there's really a herniation only happens if you have a hole in the annulus and you have fragments of nucleus next to the hole and you have a force pushing those fragments out, which comes from bending and heavy lifting. If you take away the path for the herniation to get out, you take away the force and you take away the fragments, you're not going to have a herniation. Sean? So that's how you do it. Behavioral modification and good surgery. Sean? That's really all it takes. Some restrictions for the patient after surgery. I do the surgery well, patient has some restrictions, and then their body heals that tear, and it's done. Sean? Her arthritis is really bad. Sean? Sean? That should be the spot right there. Think that will do it. We're going to move on to the next area, the SI joint. So to answer your question, behavioral modification for a period of time while the body heals. We just put in some staples. We're going to move on to the sacroiliac joint treatment at this point.